Welcome to The Learner. Upgrade your knowledge. Your journey to smart learning begins now. Stay curious. Stay inspired. The Learner, where learning never stops. Hello, doctor. I have an appointment. Good morning, doctor. My name is Ahmed, and I'm here for a checkup. I have been feeling unwell since yesterday. I started coughing 3 days ago. I have a high temperature. I can't sleep because of pain. I feel short of breath sometimes. My chest hurts when I breathe. I've noticed swelling in my ankle. I feel dizzy when I stand up. I am experiencing severe headaches. My throat is sore and it's hard to swallow. I have been vomiting since morning. I noticed blood in my stool. I have a rash on my arms. My eyes are red and itchy. I feel numbness in my left hand. I have a sharp pain in my abdomen. I keep feeling very tired all day. I have lost my appetite. My child has a fever and cries a lot. I think I might be allergic to this medicine. I am pregnant and need prenatal advice. I missed my period last month. I want to get vaccinated. Do I need any blood tests? How long will the test results take? Can you explain these test reports to me? Is this condition serious? What are the possible causes? Do I need an X-ray? Should I get an ultrasound? Will this require surgery? What will the surgery involve? How long is the recovery time? What are the risks of the procedure? Do I need to fast before the test? When should I stop eating before the operation? Can I take my regular medicines before surgery? Should I bring my previous medical records? I have a history of asthma. Are there any side effects of this medicine? How many times a day should I take it? Take 1 tablet after meals, twice daily. Finish the entire course even if you feel better. Do not drive after taking this medication. Avoid alcohol while on this treatment. Please rest for 2 days and avoid heavy work. When should I come for a follow-up? Come back in 1 week for a review. If symptoms worsen, return immediately. Your blood pressure is slightly high. We need to check your sugar levels. Please give a urine sample at the counter. The nurse will measure your weight. Step on the scale, please. Your pulse is a bit fast. Breathe normally while I examine you. Lie down on the examination bed. I will listen to your chest with a stethoscope. Take a deep breath in and out. I will check your throat with a torch. Please remove your jacket. I need to palpate your abdomen. Does pressing here cause pain? Point to where it hurts most. Do you have any known drug allergies? Are you currently taking any medications? Do you smoke or drink alcohol? How many cigarettes do you smoke per day? Have you had this problem before? Any family history of similar illness? Is there a history of heart disease in your family? Do you have diabetes or high blood pressure? Have you traveled recently? Did you get a tetanus shot as a child? Are your vaccinations up to date? Have you had any surgeries in the past? Were there any complications after surgery? Please sign this consent form. The nurse will take your blood sample now. You may feel a small pinch. Keep the bandage on for 30 minutes. Avoid heavy lifting for 1 week. Start light walking tomorrow. Use the inhaler as I demonstrated. Shake the inhaler before each use. Hold your breath for 5 seconds after inhaling. Rinse your mouth after using the inhaler. Apply the cream twice daily to the affected area. Keep the wound dry and clean. Change the dressing every day. If bleeding increases, go to the emergency room. Take paracetamol for pain relief. Do not take ibuprofen on an empty stomach. This antibiotic is for 7 days. Return if you develop a rash or breathlessness. Keep the medicine out of reach of children. Store the tablets in a cool, dry place. I recommend physiotherapy after 2 weeks. You will get a referral letter for the specialist. Please bring the referral to the clinic. The specialist will see you on Thursday. Call the front desk to confirm the appointment. We accept both cash and card payments. Do you have medical insurance? Please show your insurance card at reception. The hospital will bill your insurance directly. You need to pay a deposit before admission. Arrange for someone to accompany you home, who will look after you after surgery. You must avoid driving for 48 hours. Keep hydrated and eat light food. Avoid spicy food for a few days. Eat a balanced diet to aid recovery. Increase your water intake. Maintain good hand hygiene. Wash your hands before meals. Use a mask if you are coughing. Cover your mouth while sneezing. Avoid crowded places while contagious. Stay at home if you have a fever. Monitor your temperature twice daily. Keep a record of your symptoms. Note any new symptoms immediately. Take your medicines at the same time each day. Set an alarm to remind you of doses. Keep a list of all medicines you take. Bring the medicine bottles to your next visit. Use a pill organizer for convenience. Stop taking the medicine and call if you feel worse. For allergic reactions, go to the ER at once. This ointment may cause temporary redness. The stitches will be removed in 10 days. Keep the area elevated to reduce swelling. Apply ice packs intermittently for pain. Avoid smoking during recovery. Smoking slows healing and increases infection risk. Start light exercises after 2 weeks if pain allows. Walk for 15 minutes daily to improve circulation. Avoid air travel for 2 weeks after major surgery. Inform us if you are pregnant before taking X-rays. We will use a laid apron during imaging. You should not breastfeed for 24 hours after this medication. We will provide local anesthesia for minor procedures. You may feel pressure but not sharp pain. Expect some bruising for a few days. If you have a fever over 38 degrees C, seek help. Keep a thermometer at home to check temperatures. Monitor blood sugar if you are diabetic. Take your insulin as prescribed. Eat regularly to avoid low blood sugar. Check your feet daily for any cuts or blisters. Wear comfortable shoes to avoid injuries. Use sunscreen to protect your skin. Wear a hat and sunglasses in sunlight. Reduce salt in your diet to control blood pressure. Eat more fruits and vegetables every day. Limit sugary drinks and snacks. Aim for at least 30 minutes of activity daily. Try to sleep 7 to 8 hours every night. Manage stress with relaxation techniques. Practice deep breathing for a few minutes daily. Avoid unnecessary antibiotic use. Finish antibiotics only when advised. Use condoms to prevent sexually transmitted infections. Get tested if you suspect an infection. Discuss family planning options with the doctor. Consider vaccination before traveling abroad. Carry a list of emergency contacts at all times. If chest pain is severe, call emergency services. Do not ignore sudden weakness on one side of the body. A sudden severe headache may be a medical emergency. Learn basic first aid for home emergencies. Keep an emergency medicine kit at home. Know how to perform CPR if needed. Attend the health education session next week. Bring your child's immunization card for review. This lotion helps soothe dry skin. Apply sunscreen 20 minutes before going out. Use gentle soap for sensitive skin. Avoid hot showers if skin is inflamed. Use a humidifier if the air is very dry. For acid reflux, avoid late-night meals. Elevate your head while sleeping to reduce reflux. Chew food slowly and eat smaller portions. For constipation, increase fiber and fluids. Try gentle walks to stimulate digestion. Drink warm water in the morning to help digestion. For diarrhea, stay hydrated and avoid dairy for a while. If vomiting persists, come to the clinic. For urinary pain, bring a urine sample for testing. Use sanitary pads and change them frequently. For eye irritation, avoid touching your eyes. Remove contact lenses before using eye drops. For ear pain, avoid inserting anything into the ear. Keep follow-up appointments as scheduled. Bring your child's growth chart to the next visit. Thank you for visiting. Feel free to call with any questions. Before you go, like, share and subscribe. Your one click gives us the strength to keep spreading education.